Hello, my name's Dr. Vicky Cleak and I'm a consultant psychiatrist with a special interest in adult ADHD. And today we're going to be talking about what elements it takes to really gain mastery over the ADHD rather than the ADHD taking mastery over you. So let's get stuck in right away. If you've recently been diagnosed with ADHD, you're probably still figuring out what exactly that means for you and your family. Make sense of how that fits into your past and how to work with your brain and the ADHD rather than against it. This module is all about taking charge of your ADHD rather than it taking charge of you in your life. So many people with ADHD experience a number of other mental health problems that are commonly comorbidly found with the ADHD, such as anxiety, depression, and alcohol or substance misuse. For women, a diagnosis of ADHD may have come about due to the onset of their perimenopause, leading to sort of magnification of pre-existing symptoms and new difficulties in their life and functioning generally. So if that's you, you're absolutely not alone. In fact, this scenario is actually really common. So what comes first? Do we treat the ADHD first, or the anxiety, or the alcohol dependency, or both together? Well, the answer depends on you, what is causing the most distress or disruption in your life, and also what's going on around you in terms of your current social situation. Usually if there is a significant substance misuse or alcohol problem, those things need to be addressed at least in parallel to any ADHD. But in the vast majority of cases, it's really clear that treating the ADHD, which often underpins all of these difficulties, may well be key to ensuring that everything else settles or improves without any additional specific treatment targeted towards it. However, if you're already on an antidepressant for anxiety or depression before you get your diagnosis of ADHD, it is a discussion between you and your doctor about what you need to do about that and whether to continue with that as it is or to have a plan in place about long-term need for that medication to be ongoing whilst you're having your ADHD treated. And the reason for this is because sometimes there is a risk of the medication for ADHD and most commonly used antidepressants in depression and anxiety, namely selective serotonin reuptake inhibitors like fluoxetine or sertraline, which can interact with some ADHD medication and put you at risk of something called serotonin syndrome, and that can give you side effects and problems you don't want in addition to the ones you already have. So it's very important that your treatment plan is personalised to you and supported by professionals who know you well and can unpick all of these different aspects, discuss them with you so that you can jointly come up with a plan and you have a good follow-up with that plan going forward. Now, I'm sure that when it comes to mastering ADHD, you will know that there isn't one magic fix. It's about combining a number of things together that we know help improve the lives of those with ADHD and the difficulties they have. And today we're going to look at 6 main areas related to this, namely psychoeducation, medication, lifestyle measures that we know work, tech solutions, neuromodulation, and professional support. So let's unpack those one by one. So the first thing I say to anybody who has just been given a diagnosis of ADHD in terms of important treatment strategies is psychoeducation. What is psychoeducation and why is it so important? Well, it's about understanding the diagnosis of ADHD and how it applies to you in your life and what your specific difficulties are, what might be causing that in terms of the ADHD. Why is it so important? Well, it allows for you to adjust to the diagnosis. So most people, when they get a diagnosis of ADHD, go through a sort of grief reaction, really, where they feel a mixture of emotions, including shock, even if they were expecting a diagnosis, but also They can feel quite angry for the life opportunities they've missed and it not being picked up earlier, and also go through a bit of a low mood before coming out of the other side. So psychoeducation, understanding about your ADHD, helps you get through those stages effectively and I guess quickly. Psychoeducation helps you to self-forgive for things that really weren't under your control during your life and are down to the ADHD itself, and passing that information on to others in your life can also help to really improve relationships and understanding going forwards. You'll end up feeling much more in control of yourself and your environment, and it can help you find your tribe, so other people that have also got ADHD, and that feeling produced by that is a feeling of an inclusion rather than feeling excluded, which is something that we know is really important to all humans, let alone people with ADHD. Psychoeducation also means that you're going to be able to make much more informed choices about what treatments you want or don't want, and that you're going to be much better asking for what you need. So obviously your psychiatrist or other health professional that's been involved in making that diagnosis should be able to tell you something about ADHD in the context of your life. But as you know, appointments are usually limited in time, and so there is a lot of stuff about ADHD pertaining to you that cannot possibly be discussed and understood in those short appointments. So part of the psychoeducation is about directing you to resources that we know work, and you doing a bit of that homework in between sessions so that you can bring to the sessions any questions you have, so that further discussion with your clinician is targeted towards your needs and what you want. I suggest joining a peer group. There's a lot of peer groups that occur online now, but also there are those locally, and organisations such as ADHD UK will have a list of those online that you can get in touch with. You can also read or listen to or watch experts talking about ADHD, and there are many webinars out there that are tailored towards subpopulations of those with ADHD. For example, if you have ADHD and you're working, or if you're ADHD and you're a mother, or if you're a parent of someone with ADHD, and you can find those webinars usually free, if not limited cost to access, through ADHD UK or attitude.org. They're both really good, high quality resources. And also books or YouTube channels such as Russell A. Barkley, who's an expert in ADHD. Obviously, I'm not giving you an exhaustive list. There is a lot out there. So ask others, and don't think about this as I'm going to sit down for an afternoon, read everything I can, and that's it. I think this is an ongoing journey in understanding yourself. So the choice of whether or not you take medication is obviously very personal, and online there is a lot of unhelpful information regarding medication and some loud voices and strong opinions about whether or not to take medication. But what I would say is that the more your ADHD negatively impacts your functioning, the better a response you will usually get to medication. The medication for ADHD has been around for many, many years, and actually is one of the most researched medications we have in psychiatry, because one of the medication used, namely stimulant medication, has had its controversies in that it's a controlled drug. The upside to that is it has been really thoroughly studied, and compared with other medications used in psychiatry and other medical branches, it is pretty safe for most people. The other thing to say is that for most people it's pretty effective compared with taking an anti-cholesterol medication to prevent strokes. There are a number of different medications you can take for ADHD, and finding the right fit of medication with you can make a huge difference. And again, that's why it's really important to have a relationship with a clinician that is going to see you longitudinally and work with you to find the best medication for you with the least side effects. Most patients with pure ADHD and no other comorbidities are going to do best on stimulants. Stimulants include methylphenidate preparations, both short acting and mostly long acting, but also lisdexamfetamine, which is a slightly different medication, also a stimulant, but it seems to be more effective and is thus given first line for adults, not rather than children. But most patients will do equally well on either lisdexamfetamine or a methylphenidate type drug. Starting a medication doesn't mean you've actually signed up for life, so I would always encourage patients to try medication to see whether it makes a difference and how much difference it can make. And together, in terms of titrating the medication, you can find the right dose. That can take a bit of time, and that tends to be the downside. But because stimulant medication will work the same day as you take it, you will experience the benefits of it quite quickly, as opposed to other medications we have in psychiatry and in ADHD, including the non-stimulants such as guanfacine, clonidine or atomoxetine, which all work in a slightly different way and may be more appropriate if you've got other comorbidities such as autistic spectrum traits. So there's no doubt about it, medication can help your brain work with you, but also structure, rest and healthy routines still matter too. And so we come to lifestyle measures, those small steps that can have a big impact, particularly when used together. Let's break this down further. So there are a number of foundations that help with all mental health problems that, if addressed, can improve all of them. And that includes having a good, fresh diet, regular meals, some exercise and good sleep. Those people with ADHD often, as with other mental health problems, benefit from having supplements to maximize any mild deficiencies in their micronutrients. Vitamin D, magnesium and iron supplements in women can be particularly helpful. In terms of exercise, I always suggest a mind-body exercise as well as aerobic exercise, which can really help with reducing stress levels, such as yoga, tai chi. Obviously, you can gain extra benefit from using mindfulness or specific progressive relaxational exercise. Most patients with ADHD will have difficulties with getting off to sleep because of the mind being so noisy, and so good sleep hygiene can improve that, as well as all the other things we've talked about. And that means, having a really good routine of getting up at the same time in the morning, counting back from that 7 or 8 hours and not going to bed before then. If you wake up in the middle of the night and you can't get back to sleep within 20 minutes, to actually remove yourself from the bedroom, go and do something really, really boring until you feel tired again, and then going back to bed. There's a group of patients who may have other sleep disorders, because those with ADHD are more likely, more prone to get other sleep problems, such as sleep apnea, which can really worsen ADHD symptoms, but also delayed sleep phase syndrome, where you really want to go to bed later and get up later, but because of where you're living and pressures on your time, like having a job and young children, you're not able to get out of bed later, and thus you're continually sleep deprived. And there's some interventions such as special glasses that can really help shift that circadian rhythm problem back to normal. Organisational tools, so there are a whole number of these that can be used. Reminders, diaries, both online and with apps, having a Pomodoro timer to help get you started, having a buddy system for those people who procrastinate. There's a multitude of different tools that can be used that we know can help a bit for all of the different aspects of ADHD, and that's where working with an ADHD coach, as well as identifying where the difficulties are really important. I cannot stress enough how having routine and habits really improves the life of someone with ADHD. I think women particularly struggle because they often have to deal with their children who are at school and then have holidays intermittently, and that change in routine can really be very difficult for those with ADHD. But having a structure that you know is happening daily, weekly, and making extra steps if you go outside of that, extra steps in terms of reminders and external supports with that, will help keep things on track. And that's when we come to external supports and scaffolding. So that's being able to outsource things you find boring or difficult, such as your accountancy, sorting out the bills, having a secretary or secretarial support, or admin support at work for women that work can be exceptionally useful. Having a cleaner so that you keep on top of, the mess at home, again, can be really helpful. Women with ADHD really struggle with some of those repetitive but not particularly interesting jobs. And don't forget, your job or role matters too. If it's draining your energy and doesn't align with how your brain works best, then it's really worth reevaluating what you can do about that, whether it's the right job for you, whether you can move sideways or get extra supports in that are going to help. It is important to know that you don't have to do all of this alone. There are professionals out there who can help tailor a plan that's going to work for you. Usually a psychiatrist is the person who gets involved first to be able to make the diagnosis, as well as any comorbidities, and help you get a plan together of who you need to see to help with those things. A pharmacist might be able to help if you're having any problems with your medication. Some ADHD clinics will have a pharmacist or specialist nurse for ongoing monitoring of your medication, although I would say that these work brilliantly with straightforward cases, but less so when there are complexities such as multiple comorbidities, including problems with perimenopause alongside the ADHD. A counsellor is very helpful for helping you to adjust if you're struggling with that process. But if you need help with unpicking some of the sort of emotional and psychological damage that the ADHD has caused in the past, then going a bit deeper in terms of seeing a psychologist is helpful. A coach is really there when you have a very clear goal of what you want to work on. It's quite in need of practical skills and motivation and keeping accountability towards that goal. And a psychotherapist, somebody who will be able to help with a more long-term, in-depth look at how you function, and again, if the damage, if you like, caused by the ADHD in terms of your relationships and work are really deep-rooted, particularly if there's trauma associated with that. And of course, there are a number of tech solutions that can really help to take some of the mental load off. Focus or reminder apps, alarms, Pomodoro cubes, smartwatches. The key really is to pick tools that fit with your life, not ones that further overwhelm it. You don't want your phone screen to be a whole load of apps that you're never going to use, that you're ongoingly paying for and forget about. That's not useful. It's finding the right tool for you, and that's again where discussion on forums and with a coach can be really, really helpful. I think there's some really exciting emerging tools that will be helpful for those with ADHD, although much of this is off-label at the moment. So it's really important to at least discuss them with your clinician before trying anything new. There are some vagal nerve stimulators such as Neurasim, which are being investigated for help with ADHD symptoms, particularly anxiety and problems with sleep. And I know some people who have found those, the Neurasim particularly, as being quite helpful. No shares in Neurasim. I'm not getting any financial benefits from selling that, and this is my own opinion. Bright light therapy and specific glasses that can help with sleep, particularly for those people who have got a comorbid sleep difficulty, their circadian rhythm is off, can really help too. So in summary and putting it all together, what does mastering ADHD really mean? Well, it's about taking a multi-pronged, holistic and personal approach really. It's not just about improving symptoms, it's also about optimizing your life, and that means checking in regularly with yourself, tracking how you're doing and keeping continuity of care. When you work in partnership with your clinicians, we can ensure that there's a plan created for you that truly works. So remember, you're not alone, you're not your ADHD. You can master it, one small step at a time. If this video has helped you, give it a like and subscribe for access to all my videos about how women can master their ADHD. Thanks for watching and take care.